Good morning, everyone. Welcome to our Facebook Live session here from the Nogales Recreation Center in Santa Cruz County. My name is Eladio Pereira, the Chief Medical Officer of the Mariposa Community Health Center. And with me are two colleagues, been working with us for several months now. Dr. Phil Williams, our Associate Medical Director, and Jose Arriola from our Santa Cruz County Health Department. Welcome. Thank you for being here.
Thank you, Dr. Pereira.
Buenos días. Gracias por estar con nosotros. Mi nombre es Eladio Pereira, director médico de Mariposa Community Health Center. Estamos aquí transmitiendo desde el Centro de Recreación de Nogales, donde estamos dando hoy, viernes, mayo 14, la vacuna de Pfizer. A lot of things have happened in the last week since we spoke last. I think probably the most important is the approval of the Pfizer vaccine for ages 12 through 15. Before that we have been vaccinating those 16, 17. We have Moderna available for the 18 and older, but now we have Pfizer. The approval came on Wednesday. We had some appointments made as soon as the green light came out. We went and began vaccinating very shortly after, right, Dr. Williams?
Exactly. We like to work quickly here at Mariposa, so we did. We acted very quick. As you mentioned, the FDA, they actually approved earlier in the week, and then as soon as we had CDC approval, then we jumped in and we got people vaccinated.
And our colleagues, of course, with Jose and his team have been great in getting this done.
Yes, it's been a lot of hard work, but it's been a pleasure working with.
A lot of people don't realize it takes a lot of logistical effort to get this done. When you're doing 500, 600, 700 vaccines a day, it does take a lot of coordination, traffic control, the workflow, and then all the stuff, not just employees of Santa Cruz County, the Health Department Mariposa, but all the volunteers, security, and all of that. I'm very, very thankful for all of that. Estoy diciendo que muchas cosas han pasado. La semana pasada la vacuna Pfizer de 12 a 15 años se aprobó. El miércoles empezamos enseguida a vacunar. Y aquí estamos en el Centro de Recreación de Nogales vacunando hoy de 12 a 15 años. The other thing that happened is the new Cdc Guideline for masking. We're still going through that a little bit to see what happens, but they were changed significantly. We'll have a conversation about that. At the moment here at the rec, we do require masking for various reasons. Mostly not everyone is fully vaccinated, etc. So we require masking here. But the CDC changed. They're saying that people who are fully vaccinated against COVID-19 generally don't need to wear masks or practice social distancing, either outdoors or indoors. But there are a few exceptions to that. So what do you think, Dr. Lewis?
Yeah, so some of those exceptions really includes public transportation. So in buses, trains, planes, you are still required to wear a mask. The other caveat is, anyone who develops COVID symptoms, of course, they should obviously put on their mask. And also those that have a compromised immune system, they should contact their doctor, and they would also consider wearing a mask. The other exception is in hospital or presumably clinic settings. In hospital settings, it is still recommended to wear a mask.
So estamos diciendo que el CDC ha cambiado sus recomendaciones para el uso de mascarillas o tapabocas. Aquellas personas que se han vacunado 2 semanas después de la última vacuna, que no tienen que usar mascarilla o tapabocas dentro o afuera. Pero hay varias excepciones. El doctor Williams mencionó transportación pública, autobuses, trenes, aviones, etcétera. Aquellos pacientes que tienen un sistema inmune bajo, están recibiendo tratamiento para cáncer, toman medicinas que le bajan, esos pacientes tienen que usar mascarilla en los hospitales. So it's not absolute. There are a few exceptions, but Jose, we do require masking here.
Yes, like you mentioned, it's important to note in those guidelines that fully vaccinated people.
Yeah, absolutely.
And as you mentioned, there's people receiving sometimes their first shot, so they're not fully vaccinated. So we are requiring that here.
And Dr. Fauci said this week that we need to remember that herd immunity is still not around. Only about maybe 35% of Americans have been fully vaccinated. And, the thought is that we need more than that. We need at least twice that. So I think we're not there. Here in the county, our numbers continue to get better. If you look at the eligible population, our numbers are in the high 70s.
Yes.
So we continue to vaccinate it. We have seen some patients who develop symptoms after the first shot. And you made a comment, we need to be alert for COVID-19.
Yeah, exactly. So, if you're fully vaccinated, so 2 weeks after your second dose, the risk of getting COVID-19 is dramatically decreased. But obviously, if you're not fully vaccinated, we had a patient, a few weeks ago that was vaccinated and then with their first dose, and then a few days later they came out positive for COVID-19 and started having symptoms. You definitely can see that because again they're not fully protected. It could be that they either were infected after their first dose, or it could be that they were kind of that silent carrier who were asymptomatic and therefore got their vaccine.
Estamos diciendo que algunos pacientes se han infectado con COVID-19 después de la primera vacuna. So esos tenemos que mantener alerta a aquellos que tengan síntomas. Hay que hacerle la prueba. We get concerned about the children that are too young to get vaccinated, those under 12. And that's a group that need to wear masks. You want to comment on that?
Exactly. So in order to be vaccinated, you have to be exactly 12 years old. Even if your birthday's tomorrow, if you're not exactly 12, you can't get vaccinated. So definitely in that group, and so all unvaccinated people, you still have to continue wear a mask, social distancing.
Estamos diciendo que los niños menores de 12 años todavía no tienen la protección de la vacuna y es muy importante protegerlos y ellos tienen que usar mascarilla después de los 2 años. Es importante hablar de que las vacunas no son efectivas 100%, existe la posibilidad de infección, pero lo positivo es que aquellos pacientes que se infectan con COVID después de la vacuna tienen un número de partículas de virus más bajo. So, tiene menos posibilidad de transmitir esa información, esa enfermedad a otros. So it looks like if you get the shot, even if you become infected, the viral load is a lot lower, therefore transmissibility is a lot lower, right?
Exactly, you said it perfectly, exactly.
So, we're going to continue to do Pfizer. We do have 1 day for Moderna next week. On Monday, we already have about 700 appointments. So I think for Monday, we urge people to get registered first. We accept walk-ins, but if they can get registered, it's better. To help us prepare. You want to comment on the days that we have Pfizer next week and Moderna next week?
Yes, so next week we'll be vaccinating Monday through Friday. Pfizer will be Monday, Tuesday, and Wednesday. And then we'll have in Moderna on Thursday, and Friday we will also have Pfizer.
Okay. So we're going to be here doing that. Thank you. Let's go back to adolescents. Pediatricians such as you are recommending that adolescents get vaccinated?
100%, yeah. Just because, there's been Overall, there's still been around 1.5 million people between that 12 to 17 age group who have been infected with COVID, and over 13,000 hospitalizations of kids within the 12 to 17 age group. So even though overall, yes, they do fare, better than older people, it still is not uncommon to have a teenager or someone who's over 12 to develop symptoms or to be hospitalized.
And also, a lot of adolescents have contacts with grandparents and other family members who may be very susceptible. We hope that most of them have been vaccinated. It's possible that some have not been vaccinated. So if the adolescent becomes infected, he may do well, but the infection may be transmitted to others. They may not do well. So, I've always said this is an infection of all. One can become infected, not be very sick, and then the second one. So that's it. Jose, when children come in and they come in with their parents, if the parents have not been vaccinated, we offer them vaccinations.
Yes, that's true. And sometimes a lot of parents had said they want to wait till their children are eligible for the vaccine before they receive their vaccine. And we've seen cases where we vaccinate the whole family. That's their first dose. So yeah, absolutely. If parents come in and haven't received their vaccine, we vaccinate them if they choose.
Es muy importante vacunar a todo el hogar. Si los niños vienen y los papás no se han vacunado, le ofrecemos la vacuna. Es muy importante vacunar a todos los miembros del hogar para evitar la transmisión.
Así es.
Y el doctor Williams mencionó que es muy importante vacunar a los adolescentes. Han habido 1.5 millones de casos en adolescentes, como 13,000 hospitalizaciones, y es posible que esos adolescentes no se enfermen mucho, pero pueden transmitir la infección a los papás, a amigos, a los abuelos. Eso es una infección que puede afectar en todo el hogar. Y nuestra intención, cuando llegan aquí, recibirlos, preguntarles si quieren la vacuna y se la ofrecemos para vacunar a todo el hogar. ¿Correcto?
Sí, correcto. Llega el papá, la mamá, el abuelo, el tío, y vienen con su hijo, hija, sobrino. Les preguntamos si no se han vacunado y sí, les damos la vacuna.
Queremos exhortar a todos que se vacunen. Desafortunadamente todavía no tenemos vacuna para personas menores de 2 años. Tiene que ser 12 años cumplidos. No puede ser 12 años este año, tiene que ser cumplido. Esas personas tienen que usar máscaras, pero estamos aquí para vacunar de 12 hacia arriba. Moderna no está aprobada para menos de 18, todavía tenemos que mantener ese estándar 18, pero con la Pfizer hay más flexibilidad, podemos bajar esa edad hasta.
It's also important to note that in order to receive the vaccine, any minor, they need a signed consent form by their parents. So please have a signed consent form, and they also must have someone who's over 18 that comes with them to get the vaccine.
Yeah, we cannot vaccinate with our parents. Thank you, Doctor. Any final thoughts, Dr. Williams?
I know that graduation, is coming up, and even, the end of the school year is, I believe, this coming week. So, now is a perfect time to get vaccinated. And I know that you may be very busy with graduation season, but, you really don't want to wait. You really do want to get vaccinated. People, you may have very mild, we call local reactions, but that should not prevent you from getting vaccinated. So, we're going to be here really all of next week. So please come and bring in everyone.
And we're going to do Pfizer 4 days and Moderna 1 day, right?
Yes.
Any final comments to say?
No, I think Dr. Williams really stated the importance of everyone's busy, especially this time of year. So I think it's, get your vaccine as soon as possible.
Okay. All right. I think Dr. Williams, they're looking for you over there. Thank you for being here. I want to say thank you everyone for being here with us. Thank you, Edgardo and Marco, for being here. Muchas gracias por todo y ahí nos vemos la semana que viene. Buenas tardes. Bye-bye. Yeah. Okay. Bye.